Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
I'm experiencing pain in the front, mostly when I sleep.
Okay.
So it seems that when I relax and my shoulders relax and drop,
Okay.
then I have pain to the point where it keeps me awake at night.
How much pain from 0 to 10? 10 is emergency room.
Probably at night when it wakes me up and keeps me awake, it's probably about a 7.
7, and that's like every night.
Every night, yes.
7 out of 10.
Yes.
Okay, what else is difficult for you to do and cause pain? Reaching, lifting stuff.
Yeah, my range of motion actually is good, but my strength is depleted.
Okay.
So simple lifting of, let's say, boxes, moving things from left to right or up and down. Yeah.
So moving things, lifting and stuff, you feel pain.
Lifting is more.
How much pain?
So much pain. I would just say difficulty due to lack of strength.
Okay. How long this been going on?
Well, this has been quite a while. Probably, I would say 3 to 5 years. And I know that I believe the cause of the injury or the condition is based on the fact that I've worked for 17 years on an ambulance and I've been lifting the wheels,
doing a lot of
gurney.
lifting.
So it's repetitive motion.
Repetitive strain injury.
Yes.
Yeah.
Yes.
And you feel it in both sides, like
both sides.
Equally bad?
I would have to say right now my left is worse than my right.
Can we do something to aggravate your symptoms so we can use that before and after treatment as a measurement? Okay, what aggravated? Let's aggravate your symptoms now.
What would aggravate them?
Yeah, make it worse.
I guess having me lift something that's really heavy.
So let's get her like a 5 or 10 pounds. It's all the way in the bottom. Okay. So we're gonna get that. So have you had any treatment for that before?
No.
Okay.
No, I have not.
Let's get 2. Yeah.
Then just typical over-the-counter pain.
It's temporary pain relief. Yep.
Right.
Okay. So let's lift that and tell me how much pain. Let's do overhead.
Okay.
Okay. How much pain with that? You're moving slowly.
Again, definitely the left. I would say this pain is right there. Right there is at least a 6.
At least a 6.
And definitely the left is worse than the right.
Okay.
The right would be about a 4.
Okay. And let's put it down. Okay, let's take that. And okay, where did you feel it exactly?
I feel it when I get right to about here, and it's the front.
The front. Okay. Yeah. So I will have you take over. Okay. So that's 6 here, and how much in there?
I would say actually, this is a 6 to a 7, and this would probably be a 4 to a 5. Yes.
And going down to where?
It starts from here, and it's more like it's in
you feel it in
the
joint or outside?
In the joint.
You feel it in the joint. Okay. Okay. Let me know if that's painful. Okay.
Okay.
You feel that band?
I feel it. It does not hurt though. I mean, that hurt right there.
Okay, so. Let me know if that's painful.
Okay.
Okay. How does it feel now?
Better. Yes.
Okay. So I'm gonna work this side. Is that okay?
Yes, of course. Okay, that hurts a little bit. That's okay.
It's not painful.
Yeah, no, that's fine.
And the other side in the same area. Okay.
What isn't that called the AC joint?
Yeah.
Yeah.
Is that painful what I'm doing here?
No. Do you want me to try and push against?
No.
Just relax. Okay. Yeah, that feels good.
Yeah, I feel the line.
Yeah, can you feel that in my biceps, right?
The line you're
Yeah,
talking about.
yes.
Yeah, I feel it. That's right. How's it feel now?
That feels better.
Yeah.
A lot better. Feels
I don't feel the line.
softer?
Yeah.
Yes.
Yeah. It's almost gone.
Yeah.
Let's see if we have another line.
It's definitely along the front where you are. So
that's it's a line here too.
yes, it's like right where that seam of the the seam right. Yep, right.
Yep.
Can you feel that right in there?
Yeah.
Okay.
But it's a shorter line actually.
Actually, yes. The left one is seems to radiate further down.
No, it's that's beautiful.
Okay. So.
Okay, lift your arms up and tell me how this feels. Can you tell the difference?
Oh, much different on this movement. This movement here. There's no resistance because it was almost as if they were catching.
You don't feel the catching?
No, I don't feel that catching. So
let's try it with the weight. We did the same purple, so it matches your pose.
Much easier.
Yeah.
Yeah.
How's that?
Much better.
Any pain, discomfort, or it's fine?
It's much better.
Yeah, your muscle very weak. We gotta work on strength.
But 100% difference.
Yeah. So
very happy with that.
What do you think about ASTR treatment?
That's very good.
Yeah.
I like the instant gratification. That's great.
Yeah, it worked.
Yeah.
Yeah, thank you so much.
Thank you.
Thank you. You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.